a lot of people you'll see in the literature and in practice and online are referring to marijuana as cannabis. That's fine, a fine term as well. We choose to use the word marijuana just to kind of distinguish it from the sort of non-psychoactive components of the plant, and to really hone in on the elements of the product that are used to, by young people, essentially for psychoactive purposes or to get high. And as we'll see, there are other elements of the plant that are being introduced into the market now that also could have these psychoactive components that are important to keep in mind, and we will talk about some of that. I'd like to distinguish everything we're talking about from the topic of CBD, which I'm sure many of you are aware of and see a lot of in every single store that you walk into, and it's marketed for all sorts of purposes. But essentially, that does not have psychoactive components, and it's not really being covered in this presentation right now. I think it's important to note that marijuana is actually the primary substance for which young people enter addiction treatment or substance use disorder treatment. So just keep that in the back of your mind as we go through the rest of this, because there are a lot of misconceptions around essentially the potential risk or harms of marijuana that we'd like to dispel. Okay. So there are several methods of use of marijuana. I'm sure you're familiar with most of them. The smoked version is the most popular and common, and it could be done with a joint or a blunt or a bong or a hookah. Somewhat more recently, ever since vaping became a thing with nicotine vapes, people are vaping marijuana as well, and putting them into those kind of vape pens or cartridges that you could see people walking around with. And we'll talk about why that's concerning. There's dabbing, which involves, using a concentrated form of that is very high in THC content. And there are edibles, which is also especially concerning for young people. So it's essentially the cannabis oil or concentrates are baked or infused into snacks and other food products and some beverages. And they're very hard, nearly impossible to distinguish from the non-marijuana versions of these products. So clearly, as we'll talk about, that poses a significant risk, especially to young kids who don't know the difference about what they're putting in their mouth. But what's really important to keep in mind is that for both currently for smoked marijuana, but even more so for vaped, dabbed, or edibles or other forms of marijuana where the concentrates are used, the concentration of THC, which again is the component of the product that makes you high and has effects, psychoactive effects, is extremely high.
So may I
Please jump in? Yes.
So here comes lived experience that those vape and dab pens are very easily hidden on the person. So kids can easily hide it in a pocket, their waistband, in a hoodie, because they're very small. So they're very easy to hide. And as Linda mentioned about the edibles, they're put into so many different products that people can be exposed to them unbeknownst to them. There was an example at a school nearby recently where there was a substitute teacher and a student was eating gummy bears in class. And so the teacher questioned them. So the student offered some to the teacher, and the teacher ate, I don't know how many, but several THC gummies and did not know. That substitute teacher ended up leaving the school that day in an ambulance, and the student left that school that day in handcuffs. So it's something to really be aware of, because who's going to think that gummy bears could be harboring a serious drug? So it's part of being aware as a parent, as an educator, as a healthcare worker, as a caregiver. So I just wanted to point that out.
That's right. Definitely one of the reasons why, you commonly hear today's marijuana is not your parents' marijuana or your grandparents' marijuana. Like, let's keep that in mind, because it's essentially a different product. Like, it really bears very limited resemblance to what was around 20, 30 years ago when many people on this call were younger. So I just want to throw in there also that just there's so much confusion around the topic of marijuana because there are a million products and they sort of all go under the category of marijuana, but they're quite different. So there's something that's called synthetic marijuana, which is extremely dangerous, very highly psychoactive. This is not really technically from the marijuana plant. It's essentially some plant matter, but it's been sprayed with synthetic psychoactive substance that's similar to the THC that's in an actual cannabis plant. And there are a whole bunch of newer versions that are much more potent than the traditional version as well. And it can cause really very severe symptoms if somebody is using what's known as synthetic marijuana, which again, remember, is not technically marijuana. And it can lead to extreme anxiety, paranoia. You can have people sort of walking on the street, not knowing what's going on, almost like psychosis-like symptoms, very rapid heart rate, vomiting, violence, suicidal thoughts. Now, some of these symptoms we're going to talk about can also appear in people who are using THC from the cannabis plant if it's in a very highly concentrated, potent form. But I just did want to distinguish it from what's out there known as K2 or Spice or some newer versions of the product that are actually synthetic or man-made. So how many young people use marijuana? I mean, we could do multiple slides and presentations just on the topic of trends and which kids are most at risk and who's using. So I just wanted to give a quick snapshot about what things look like right now. So we do know that marijuana is the most widely used drug among teens and young adults. And I do want to keep in mind young adults, including college and older as well, aged young people, because they are using marijuana at very high rates and continue to be at significant risk, just like teenagers. So in the most recent data available from the Monitoring the Future survey, which is a national survey that's nationally representative, but it's a school-based survey of 8th, 10th, and 12th graders. Altogether combined, they report that close to a quarter of students have reported using marijuana in their lifetime, about 20% in the past year, 12% in the past 30 days. Past 30 days is relevant because that's usually what's considered current use. So if somebody is using in the past 30 days, you kind of consider that person as more of a regular user than someone who may have just tried it once or twice in their lifetime. And about 3% report doing so daily. If you look at different national data sets or local data sets or data sets from particular states, you're going to see very different numbers because it is a function a little bit of the methodology of the particular survey, but this just kind of gives a sense of the scope. And then when it comes to vaping marijuana, which is of significant concern when it comes to young people, we have close to 10% reporting doing so in the past month. Again, keeping in mind that past month means it's something that they probably are doing more commonly. It's not just a rare event. So I'm going to report on 2021 data for the older students the young adults, because they do not yet have data from 2022 on them. But we do know that at that point, the rates were so high that the national government came out several times saying that the rates have reached historic highs with close to 30% reporting use in the past month, like currently using marijuana, 11% reporting doing so daily. So it's really a significant problem among young adults. And the reason we're concerned about young adults, as we'll get to in a minute, is what you may have all heard many times about brain development, how young people's brains continue to develop and evolve from adolescence well into their 20s, up to 30, and some, possibly as well. So it's really a very important developmental period to protect the brain, and the fact that so many kids or young people are using marijuana in this age range is really of concern. And obviously what's really important is that the majority of people who reported using marijuana for the first time were under 21 years old. So even though we have this legalization trend where it's meant to be for adult use only in the states that are allowing it, the majority of people who reported taking up marijuana use are minors, so they're under 21 years old. So there are so many reasons why young people will choose to use marijuana. I like to put peer influence as a very important one, just because in study after study, kids who report, I'll say kids, but I mean young adults as well, who report having peers who use drugs, including marijuana, are really at the highest risk. It's one of the strongest predictors of a young person's likelihood of trying the drug. It may not be the highest risk of actually becoming addicted, but certainly of trying. I'd also like to point out the problem of misinformation. And when it comes to marijuana, of all the other substances that we study, it's really a key concern, because we tend to glorify and laugh at marijuana use, and we really downplay its harms. And that's, again, coming from a perspective from 20, 30, 40 years ago, where the nature of the drug was really quite different. And although it did have effects and some harmful effects, it really doesn't resemble what's happening today. And also with the legalization trend, what happened was the availability of medical marijuana, which has, important uses in some cases, brought about the effort to legalize marijuana more broadly for adult recreational use or personal use. And so when you have a substance out there that is considered medicine and that is okay for adults to use, clearly young people are going to perceive it as relatively harmless. And we did a survey of teens, and we found that about a third reported that their main source of information about drugs, like including marijuana, is things like social media and other teenagers and the internet, which are largely unreliable sources. So instead of getting their information from parents or schools and, let's say government websites that we can hope to some extent are more reliable, a lot of kids are just getting their information from places that's not really that reliable. And so they have these misconceptions. And we do know that this misinformation can lead young people to think that it's quite harmless, and not only harmless, but even medicinal and beneficial for reducing many of the symptoms that today's marijuana are touted for helping, such as anxiety, insomnia, and other things. Stormy, would you like to chime in here?
Absolutely. So
sure.
There was one of those misinformation that my son was given when we had a talk with him back when his marijuana use started. And he said it was often promoted. I'm not saying coaches, but by other students, saying it actually enhances your performance because it blocks pain. So you can go harder on the football field or take more pain on the wrestling mat, whatever it is. So that was some of the misinformation that these kids actually believed. So it's one of those things that gets passed down from upperclassmen to lowerclassmen as they enter these sports. So that was something I had, I thought it was ridiculous that he's coming home telling me that there are benefits to it. And as Linda stated, there are so many pro cannabis websites that dispel a lot of misinformation to our young people. And of course, they're going to find it.
That's right, Stormy, thank you. And I do want to say that along those lines, the adults in a kid's lives, their attitudes and behaviors are so important in sort of determining what young people's perceptions are and therefore inclinations are regarding marijuana use. So we do know from the research that young people are more likely to use if their caregivers are lenient about it, if they use it themselves and model, so let's say an adult wants to use marijuana in their personal time and it's legal, that's all good. But if it's sort of all done in front of the young person, sort of in a jokey way and very casual, or misused or overused, then that really has a significant effect on the young person. There's also, this comes from the alcohol literature as well. There's a very, very strong misconception among adults that if you kind of teach your kid how to use it responsibly or use it with them in the home, and it's better if they're using at home so they're not using it outside the home with friends where I can't monitor them. That all makes so much logical sense. And I have 2 teenagers. I've thought that way as well. But the research is just so consistently clear over and over again, study after study, that the kids who are allowed to use in the home, whether it's alcohol or marijuana with their parents in order to learn how to do so responsibly, end up having, on average, more trouble when they leave the home. So when they go to college or enter the workforce or just finish high school, and even in high school. So they end up having more problems with the substance. And again, when I say that, everyone says, well, that's not what happened with my kids. I taught them how to use it and they're fine. And certainly there are anecdotal cases where this isn't true and that kids who do it with their parents in the home are fine. But when we look at the research on a broader scale, the very overwhelming evidence points to the fact that if parents are kind of consistent and not allowing their children to use it in the home or with them, then those kids are going to be more protected down the line. And we'll talk more about that later. And it's also obviously if parents or other adults, whether it's teachers or healthcare providers or coaches, don't communicate openly and honestly about the risks with young people, then that also is a risk factor because, certainly not scare tactics, those don't work, but young people really do want the honest, accurate information and the science-based information. And that's been shown over and over again with surveys of young people. So if people are not doing that and kids are sort of left in a cloud of uncertainty and they have to turn to unreliable sources for information, those kids are going to be at higher risk. Now, I cannot emphasize enough, and Stormy, I'm not sure if you'd like to chime in here as well, but the significant risk for marijuana use when it comes to mental health problems and stress, and the fact that a lot of kids are using it to self-medicate. So a lot of people, for reasons that we've discussed, think that marijuana will help them relieve their feelings of depression or anxiety or stress. Again, the research evidence is very clear that over not even such a long term, but to the contrary, that marijuana can make existing mental health problems much worse. And clearly heavy long-term use increases the risk for the exact problems that people are self-medicating for and for much even more severe mental health issues such as schizophrenia, increases the risk of suicidality, and it certainly worsens the symptoms of other mental health challenges. And before I turn it to you, Stormy, if you'd like to say anything, I just want to throw in sleep as well, because that's another bit that it's, a lot of people do use marijuana as adults for sleep purposes. We do know that for young people, the research shows that continual or chronic use of marijuana actually does the opposite of what you're hoping when it comes to sleep. It increases the risk of insomnia, daytime sleepiness, sleep deprivation, and poor sleep quality. So again, this is like a combination of the misinformation in there, but these are some of the reasons that young people report using.
And Linda's absolutely right that a lot of kids, it starts with self-medication, whether it makes them feel more comfortable socially because they have social anxiety, more so than to just, and of course there's that just wanting to fit in. As I said, my son has an ADHD diagnosis and anxiety and depression diagnoses came later. And I think in there, he began to try to self-medicate. But Linda illustrated very, very well that kids, and adults, it's been shown, they think that it's going to help with anxiety and it might take the edge off their anxiety in the moment. But that anxiety continues to ratchet up higher each time with marijuana use, with the THC. So it in fact has the opposite effect of what they're searching for. And that cannabis, that THC induced psychosis is very real. And I think we'll cover that in a future slide. And that's a scary thing, but.
Yeah. Absolutely, Stormy. And I also just want back to the peer thing just for 1 minute, because I know a lot of adults, are coming out of being in school in, let's say, the 80s or early 90s or 70s. This notion of peer pressure as a real reason why kids use. And it's often framed in older people's minds as, your child is sitting in a group of other friends and they're kind of making fun of him or her for not using, or there's like this real, like very overt, explicit pressure. And I think nowadays that certainly happens now and then, but I think more so the pressure is subtle. It's not kids saying, oh, you're a loser if you don't use, or come on, just this once. There's some of that, but I think for the majority of kids, it's more what Stormy was saying, which is this desire to fit in. So if you're seeing your friends doing it and they're enjoying it or they're using it at parties, then you just kind of want to be a part of that. And it's less this sort of explicit pressure. And the reason I think that's important to note is because there are some intervention or prevention programs that really stress and emphasize, the skills to learn how to say no to people who are pressuring you. for young people. And I think that's important, but I think it misses the boat if that's the majority of the intervention, because a lot of times it's not that kind of exchange, and it's more the child's own internal pressure of wanting to kind of have this social lubricant and fit in with their peers. But anyway, I will continue on. I do want to talk about the marijuana policies and laws. It's a massive topic. And again, certainly multiple presentations can be given about it, but just to give a basic sense of what's happening. So marijuana has been illegal on the federal level and remains illegal on the federal level for possession, sale, and cultivation. There's obviously a lot of bills and acts in Congress right now where it's being discussed to legalize marijuana for adult use, but currently it remains illegal under federal law. It's still classified as a Schedule I substance by the Drug Enforcement Administration, which means it's viewed as highly addictive with no current accepted medical use. That's clearly being challenged because we have medical uses for, although a much smaller number than people think, for certain forms of certain elements of cannabis. But what has happened recently is that it has been decriminalized on the federal level, and that is to address the very real concern about the illegality of marijuana putting people in jail, and obviously the social inequities and racial inequities that have come from that, and it's the whole war on drugs approach. So to some extent, we've moved in a really nice way, or a really, needed way, from this very, justice focused war on drugs approach to marijuana to one that's more of a public health model. And that's where we come at it from. But just so you know, the federal level, it's still illegal, but in many cases decriminalized for federal cases. On the state level, as of now, there's 22 states, 2 territories, and Washington, D.C. that have legalized marijuana for adult, personal, non-medical use. More states have done so for medical marijuana. More states have decriminalized low-level marijuana possession offenses, so you won't go to jail for it anymore. But I do have to say that there's so much variation between states about this, this is presenting it as a much cleaner picture than it actually is. I mean, there's just a lot of variety between states and how they are addressing marijuana use and possession. When I talked about CBD on that first slide, which is the version of the element of the plant that people use for health and beauty and those kind of things, that all states allow some form of CBD use, because again, that's not a psychoactive substance in any significant way. But please keep in mind how much these rules and regulations vary between states. So what's more of concern to this talk is this movement toward legalization, which certainly has its merits. It does have significant implications for young people that we really can't gloss over. And kind of watching the scene in the past couple of years, a lot of states are glossing over it, which is concerning. So what we do know, and there is research evidence to show this from following young people in states that have legalized, we know that it normalizes marijuana use among young people. It reduces their perceptions of how harmful the drug is, and it makes access to the drug much easier for them, which all makes a lot of sense because it's available in people's homes and in the neighborhoods and in dispensaries. In states that have legalized, we also know that the rates of initiation or first starting to use among young people are higher than they are in the national average for this age group. So young people initiate at higher rates in states where it's legal. And we also know that legalization is associated with increased rates of just regular using of marijuana among young people, intensity and rates of use among young adults, and also other substance use. So in states where it's legal, not only are young people using marijuana more, but they're using other substances as well to some extent. And we also know that there's an increased risk for marijuana use disorder or addiction among young people, and certainly a very significant increased risk of unintentional exposures or poisoning or consumption among very young children who end up going to the hospital for it. So there's this false sense of security, of safety of products that contain THC, but in states where it's legal. And that's really an issue because even though it's legal and somewhat regulated, most are not well regulated. So there's a sense that, oh, well, it's legal in Colorado. So if I buy marijuana in Colorado in a legal dispensary, I could be sure that this product is safe. That varies quite a bit between states and where you buy it and between neighborhoods. So it's just a very new phenomenon, and it's not well ironed out yet. What's more important is that we know that in the United States, when a drug or substance is legalized, so think tobacco, think alcohol, and now think marijuana, it ends up being commercialized, which is not how it is in many other countries that have legalized certain addictive substances. But in the US, if it's legal, it tends to be commercialized. So what that means is it allows profit-driven industries to produce and package and advertise and sell the product, and it's often at the expense of the public's health. So in some other countries where marijuana is legal, you won't see the extent of advertising and marketing and sort of child-friendly packaging and the commercialization generally as you do here in the US. And we know from past experience with the cigarette manufacturers and alcohol and vaping, nicotine vaping, certainly, how when industries sell an addictive substance that are legal for adults to use, they don't just happen to appeal to children, but these industries tend to target youth in many ways through the way they design the products, market them, where the retail outlets are placed, so which neighborhoods they're in, how close are they to schools, parks, and certainly in the advertisements. And again, this could be a whole other presentation showing you examples of how that is the case already when it comes to marijuana. And also important to know is when we think of the marijuana industry and the way it's talked about a lot, we kind of are told it's these small little mom and pop shops that are, just trying to sell, marijuana to the local community. But in fact, over the years, and more so now than before, the main players in this industry are the same ones who are in the tobacco and alcohol industries, and they're using the same playbook of tactics to target young people. And you may say, well, why are they so interested in targeting young people? Well, there's just tons of evidence that if you get a young person to like your product and have some brand loyalty, they will be a lifetime customer for you. And certainly it's true with alcohol and cigarettes that your older populations of consumers get sick or die or stop using it. So you need to kind of replenish with the younger generation. So it's not a mystery that, a lot of these products and the advertising and marketing of them are targeted to young people. And we can see it really, it's quite evident if you look at what some of these products are like. They come in sweet flavors with kind of very child-friendly names and packaging in ways that appeal to youth. They're already, the edibles are in candies and snacks that are virtually impossible to distinguish from the non-marijuana products. And there's been tons written about that and a lot of legal action around that, but it's just all over the place. And then there are the health claims that are on a lot of these products, which are unfounded for the most part. And they're basically marketed by celebrities and by the advertising as cool and fun and essentially harmless. So all this is sort of the landscape in which kids today are living and what they're experiencing when it comes to marijuana products. And, no wonder it kind of shows up in their attitudes about how risky or harmful these marijuana products are. So this is sort of, again, a very broad stroke of it. But as you see, when you go from 8th grade to 10th to 12th, the proportion of students who think it's really easy to get or fairly easy to get a marijuana product increases pretty significantly. And the proportion that think that there's some great risk in using it here or there or more often declines pretty significantly. And one implication of this, just to consider, is that, in 8th grade, we still have kids thinking that it's kind of harmful and not so easy to get. And that pretty quickly goes down. So it's just another reason why we want to start prevention efforts and communication and interventions and having these conversations with kids at a pretty early age before they get to the point where, we've kind of lost them. So this really illustrates another element of why we should be so concerned about today's marijuana, which I've been sort of alluding to throughout, as has Stormy, which is the potency of THC in marijuana products, and I'm sure many of you have heard this already, has increased extremely significantly over the past 25 years. It's nearly quadrupled from about 4% to 15%. And if you go back a little farther, it's even more so, because prior to 25 years ago, it was more like 1% to 3%. And what's especially concerning are the products that are favored by young people, like the concentrates and vapes and edibles, sometimes have upward of 90% THC, which is, almost pure THC. And again, that is what causes all the effects that we're concerned about, including, visits to the ER among young children and also teenagers. And I'll talk about some of the other consequences in a minute. But we do know that the higher the THC in the product, the higher the risk of addiction, psychosis, depression, anxiety, sleep problems, memory loss, suicidality, and other things. And what's interesting here, if you see on the right, that flat line on the bottom, that's the CBD. So essentially, marijuana products have both CBD and THC in it. The CBD has not been increasing much, but the THC has increased proportionately quite a lot. Stormy, did you want to chime in here? You're on mute, Stormy.
Sorry. Thank you. This information I learned about 5 years ago when I took a class with NAMI on mental health awareness. And I was absolutely shocked. And I think this is very important information that people should have. As Linda stated, back in the 1970s, the amount of THC in marijuana was between 1% and 3%. So when people say, oh, well, my grandpa smoked weed in the 70s and he's fine, it is not, you're not even comparing apples to apples anymore. We're not talking about the same substance effectively. If you look at the chart Linda put up there, how different things have changed. So the CBD levels have remained consistent, but the plant has been modified and hybridized and grown to have higher and higher and higher concentrations of THC. So that back in the 70s, marijuana wasn't considered an addictive drug. It was maybe habit forming or something, but never considered a drug that would be addictive. But as in a previous slide, Linda had pointed out that it is recognized by the federal government as being highly addictive. So we're not talking apples to apples. And that's part of my concern with the push for legalization for recreational use, is that the people promoting that, I believe, are probably misinformed. I believe a lot of people are thinking that it's the same drug, the same plant that existed back in the 1970s, and it's not. It might look the same, but it is very, very different. It's not like, it's okay because it's a vegetable. It's plant-based, and that's not true at all. There, you don't want to eat poison ivy. But I just think that this is a very eye-opening piece of data for parents, for legislators, for caregivers in the school and in the healthcare system. I think it's very important data. And it has stuck with me in the forefront of my mind ever since. So I appreciate you sharing that information, Linda.
Sure, yeah. And, just to be clear, this comes from these data are, as it says in the title, is from samples that have been seized by the DEA. So, it's hard to tell exactly what that means for samples that aren't seized by the DEA, but just to kind of keep that in mind for context of what the chart is representing. So again, I talked briefly earlier about human brain development and why it's so concerning when it comes to young people. And again, we're not talking about what happens to adults, and some of these effects occur to adults obviously as well who use marijuana on a chronic level, but we're talking about young people here. And we do know for a fact that adolescents and young adults are the most vulnerable to the effects of marijuana, obviously, aside from young children who take it unintentionally and have the physical effects. It directly interferes with brain development. We have in our brains receptors that, are very conducive to the kind of same chemicals that are in marijuana or, relate to them. So it has direct effects on the brain in that sense. Especially the parts of the brain that are responsible for decision-making and memory and attention, impulse control. So basically the cognitive skills that are so important for young people to be developing in a healthy way at this age. And we know that the use of any addictive substance, including marijuana, during this period significantly increases the risk of lifetime use of other substances and of addiction. And again, if you look at those cognitive skills that are directly affected by marijuana use, those are the ones we kind of really want kids to be doing well in, right? Like that they're in their academic, career at that point. So memory, attention, decision making, and judgment are all critical skills for young people that can be affected by marijuana use. And it can also have some unpredictable effects. So it's not to say that every child or young person who uses is going to have the same outcomes, obviously not. But because there's so many factors that are involved in determining who's going to kind of experience more harm than someone else, it really makes it hard to predict the reaction of any one individual. So that's kind of an important thing to convey to young people when you're talking with them, that it's a little hard to know, because there are so many factors involved, just if one person's going to end up really experiencing harmful consequences or not. Because every kid, when you have this conversation with them, is going to say, oh, really? Well, my friend Joe smokes every day marijuana, and he's straight A student and on this team and on that team and doing great. And that may be true of your friend Joe, and that's terrific. But chances are, of the friends who are using, there's going to be quite a few who are not going to be doing that well down the line. And it's just kind of hard to know who that's going to be, other than what we do know about the classic risk factors. But from a child's perspective, that's kind of hard to determine. We also know it could produce effects that are similar to a depressant, a stimulant, or a hallucinogen. So the drug is kind of interesting in that sense, unlike many other addictive substances. And it depends a lot on the THC dose and the individual's physiology, what the exact effects are going to be. And we certainly know, and this is not really up for debate, that the effects can be amplified and significantly more dangerous when it's combined with other substances like alcohol. We know it impairs driving, and we're seeing in states where marijuana has been legalized for adult recreational use, increases in THC-related impaired driving and crashes. It causes disorientation, it can impair judgment, makes it harder to track lanes, reaction time is impaired, and general motor skills are affected. So a lot of people, especially young people, think, well, you're not going to drive fast and erratically the way you do under alcohol influence, because marijuana kind of chills you out. But going too slow or not being sort of sharp and fast could be quite deadly when you're driving a car. And we know that drivers involved in car crashes with high levels of THC in their blood are many times more likely than those not under the influence to have been responsible for the crash. So again, it's the driver that's really of concern. And we now have more drivers who are stopped who have marijuana in their system than who test positive for alcohol. Many young people use both alcohol and marijuana. They call it getting crossed. And that is really significantly dangerous because, for many reasons, obviously it impairs judgment even more than if you're just using one. But one important concern to keep in mind is that it can make it easier to drink to the point where you develop a very high blood alcohol level, because typically if you're just drinking and your BAC gets pretty high, your body's reaction will be to vomit and kind of get rid of some of that alcohol. But marijuana is actually inhibits vomiting. So it could kind of work against that natural impulse to vomit out the alcohol. And so you can get alcohol poisoning if you're also using high levels of marijuana. We're going to share these slides. I don't want to take too much time. I want to leave enough time at the end for the specifics, but so many physical and mental health effects, from obviously if you're smoking it, the cough, bronchitis, respiratory effects, asthma. There's one important thing I do want to raise, which is this uncontrolled vomiting and abdominal pain that can occur in very high chronic use with high level THC products. A lot of young people who have this reaction of this uncontrolled vomiting or stomach pains, they may not realize what it's coming from. And a lot of times healthcare providers are not quite sure. So I would say to those healthcare providers in the audience that if a child is admitted with these kind of symptoms, to think quickly about the possibility that they're using high THC products in a chronic way. We talked about the effects on school and academic performance and on mental health. There's also just this is a same notion from the 70s and 80s, this amotivational syndrome, that it makes kids more apathetic and less likely to carry out long-term plans and prepare for the future. but that remains true today, and probably even more so with the high THC products. And then for people who get pregnant and have children, marijuana use during pregnancy is a whole other topic, but we have strong evidence. In fact, a study just came out this week showing the significant link to lower birth weight and other adverse effects in the fetus of somebody, for people who smoke or use marijuana during pregnancy. Stormy, did you want to say anything on this one?
Well, it's just a reiteration of what I said before. We noticed with our son that his anxiety was getting higher and higher and higher. We weren't aware of all the THC use at the time, but it was driving panic attacks and anxiety higher and higher. And there were episodes of, I don't want to say because he didn't have an official diagnosis of having a THC-induced psychosis, but he certainly had a couple instances where he behaved as though like nothing made sense. Nothing was making sense. His behavior didn't make sense, his reactions. So definitely, these are very true, and it can come out of nowhere. They may use for a period of time without having, and not, as Linda said, not everybody might have THC-induced psychosis episode, but it may still happen. You don't know, and that's scary. And I know of a story where someone did have the cannabinoid hyperemesis syndrome, and it took a while to be diagnosed, because I don't know, Linda, I could be misinformed, but that seems like something new. I had never heard of it before the past year. So that can be very scary. So you're right. It's something that healthcare workers have to think about. It has to be on their mind when they see these patients.
Yeah, I mean, it's been linked to these much more high THC products that have been coming on the market in the past couple of years. So you're right about that. I mean, it may have occurred in the past for someone who's a heavy chronic user of lower THC products, but it wasn't recognized as a syndrome at the time, but now it is. Thanks, Stormy. So just a couple more things. When we talk about addiction, or in this case, it's called the marijuana use disorder. This is from data that we analyzed from the National Survey on Drug Use and Health, which is another national survey of the population ages 12 and older. And it's such a clean line, this downward slope. It's essentially matching the age of first use of marijuana and the risk of developing a marijuana use disorder as an adult. So very clearly, the later someone starts using, the lower their risk of developing the disorder, which just highlights the importance of protecting people in their adolescence and early adulthood, as you see, up until age, I don't know, you can put the mark wherever you want, 19, 20, 21, 22, but it just continues to go down. So this plays into what we always say in the prevention world when you're talking to kids, which is, preferably don't use, but if you're going to use, delay for as long as possible, because the earlier you use, the higher the risk down the road. I just want to mention the added risk of vaping marijuana, which we already talked about a little bit. So there's the THC, which is much higher, but it's also that when you vape, there's not that smell that emerges with smoke marijuana. It's a different kind of smell, and it's much more subtle, which allows it to be used more discreetly, and it can escape the notice of adults. So therefore, because it can escape the notice of adults, it could be used at home and in school and in places where adults are, and also can be used much more often than, let's say, somebody who would be smoking a joint. And this is the same for nicotine vaping. Like if you were smoking a cigarette, you wouldn't just light up a cigarette in your classroom, but kids are sitting in class, vaping these products because it's really hard to detect. And the consequence of that is that they could be doing it much more frequently throughout the day, exposing themselves to much higher doses of the active ingredients. I'd also like to just mention laced marijuana, which we just know that many marijuana products are not well regulated. There's some talk out there of, any marijuana product can have fentanyl in it and can kill you. I'd be a little cautious about just, throwing that out there. There have been some anecdotal cases of that, but it's not really well established at this point. I'm not saying it doesn't occur, but what we're really concerned about are marijuana that's laced with toxic additives that can cause seizures, that can cause brain damage, that can really harm the lungs. And as you know, right before COVID hit, we had this other epidemic, which was known as EVOLI, which was vaping-induced lung injuries and deaths that was just growing and increasing, and the CDC was following it closely, and then COVID came and everyone stopped talking about it, although if you look at the data, it's continuing. At the time, they kind of misattributed it mostly to vapes like Juul, which were nicotine vapes. The reality was that it was coming from THC or marijuana vape products for the most part. These are high THC products that were laced with toxic ingredients to basically cheap additives that really cause significant respiratory and other physiological symptoms to people. And it was affecting a lot of young people as well. So just something to keep an eye on. Stormy, was there something here you'd like to add?
I did want to say that I have heard from educators just what you said about students being able to vape nicotine or THC right in class. They might have it in their sleeve, or wear these long hoodies or whatever, and just be able to tip their head down, or they bend their head down and they are vaping right in the classroom while the teacher is at the board. It makes it much more difficult for us. We have, you talked about the laced marijuana. There have been overdoses linked to fentanyl laced marijuana. So what they're buying, they don't know is safe. So it's a serious concern on its own. But as you talked about some of these other chemicals in the vapes, etc., but also the marijuana plant itself, they're buying the weed, but it happens to be laced with fentanyl. And there have been a number of overdoses across the country due to that in the past year. It's a scary situation.
So what we'd like to turn to now are just some actual specific tips for parents, and then we're going to turn to school professionals and then healthcare professionals. There's the obvious stuff, which we'll obviously cover, but I hope there's something in some of these slides that are a little different from what you might typically think of on your own. So again, I'll try to go through these kind of quickly because there's a lot, and you will get these slides later and feel free to look at them. But what's important really is for adults, parents, and others to really know the facts, because the young people are all over this information, especially if they're motivated and interested in using, and they're going to come back at you with the facts, and they did their research. So you really have to be informed and with valid, up-to-date information about the risks, what the research shows. And again, that's so much to ask, and it's not something most people have time to do. So there are really useful resources that consolidate that information, which we'll share with you. But you want to be able to answer young people's questions honestly and credibly. The minute that a young person detects that you're making stuff up or exaggerating or, just being alarmist, and then you're no longer the person they're coming to for information. So you got to be kind of careful about that. And it's really important to listen in a way more than you talk in these conversations. You kind of want to gauge what your young person knows and thinks and is wondering about, so that you could provide the right information there. And we really want to get young people to go to these trusted adults with their questions rather than going to unreliable sources. And part of that is to really start early to have these conversations. You do not have to worry that by talking about it, you're going to all of a sudden spark an interest in your young person to go and try it. It's really unlikely that that's going to happen. And it's really unlikely that young people today have not heard of marijuana or know what it is. Or that people use it. It's kind of everywhere. So if, I'm not saying to talk to your 2-year-old about, marijuana, but really once they're in certainly middle school, it's definitely time to start having this conversation, because that's when it starts. And at a younger age, I would say you could still have conversations that are not particular to marijuana, but really about putting things in your body that aren't food or drink, or that your parent didn't give you, sort of not just kind of having that sense of health and what's healthy to put in your body and what's not. And when you want to have these conversations, we used to think of it as like, okay, kids, today let's all sit in the living room and we're going to have the conversation. You know, it's very formal, it's high pressure, and it doesn't really work well. And the kids are just going to roll their eyes at you. So you kind of want to do it as casually as you can and find opportunities to bring it up in conversation. And it could be if you hear a news story or watch a news story together where something comes up about it, or an advertisement is in front of you, or you're passing someone on the street who's using, or you smell the smell. Those are all casual ways to bring it up, and to not think of it as like a one-time conversation and, okay, check, I did the conversation about marijuana. This is an ongoing thing that has to be talked about over time in age appropriate ways. So it's going to evolve as the child ages. And as always, for everything, you know, when we talk about substance use in young people, the focus is on health and safety as opposed to punishment and control and threats. It's going to be much more effective that way. For the most part, I know different families have different perspectives on how to raise kids, and certainly different, you know, cultural views and all that on what works with their children. So I'm not trying to say what's going to work with your child, but again, on a general level overall, if the young person feels that the reason you're concerned about it and talking with them is because you really want to protect their health and their safety, as opposed to controlling them, then that will go farther for the most part. And one other important point is that if there is a family history of addiction in your family, or, you know, substance misuse, it's really worth telling the young person that, because that is such a significant risk for developing problems down the line. And just like you would tell your kid if there is a history of some other disease in the family that can have an impact on them and that might affect how they live their lives, you would do that with this as well. So if you have a history of heart disease or diabetes, that might be something you would tell a child so that they can kind of be careful about their diet or some other risk behaviors. And the same would be true here. Can't emphasize enough how important it is to understand why a young person might be interested in using. What is their personal reason for being interested in it or for choosing to use? Is it the social pressure or the curiosity or the self-medication, all the things we talked about before? Because understanding the reason why is really important for helping them kind of find alternative means to address that need that does not involve using marijuana or other drugs. And you can really work with them to find healthier means of addressing it. And I could stop there, Stormy, if you wanted to say something about that.
Yes, something that we learned when I was doing the coaching class for the peer parent coaching with the Partnership to End Addiction, is to listen, and you want to understand their why, because there always is a why. I'm going to recommend another resource here that is, it's called the Parents 20-Minute Guide. It's a very useful tool in learning to communicate effectively with your loved one, whether that's a child. Actually, there's a version if you're dealing with an older child or an adult. The Parents 20-Minute Guide is a very useful tool to help you learn to communicate and understand their why. Because, you know, if they're self-medicating for one reason, you might be able to help them overcome that. Or if they might be interested in using to overcome some social anxiety, maybe there's some other things that you can offer to them that would make them feel more comfortable without feeling that need to use a substance to take that edge off. So listening and understanding why is important, because there's always a reason.
Yeah, and I'll just add that there are those kids who are using just because they find it fun and they like it, and it sort of helps them relax, or they like to, you know, in social situations and they really don't have any other mental health issue, or, you know, so there are those kids. And if that's why your kid is using and you're going at them with the whole, hey, do you need to see a psychiatrist for your depression? They're just going to look at you like you're off. So really understanding what their reasoning is can help you tailor your messages in a way that's appropriate and seems to track with what they're thinking, instead of just sort of making it sound like you're reading off some script that you learned in a webinar like this. And then there's also another important message to convey, which is sort of like a reality check for young people who basically, if you ask any young person nowadays, or many of them, they're going to say, oh, everybody uses, everybody smokes, everyone uses marijuana. And this, it sounds casual, but this overestimation of the number of people who do it is really does directly link to a young person's own inclination to use, because they obviously want to be normal and like everybody else. The fact is the majority, I mean, I gave the numbers early on, we had like a quarter using, the majority of people don't use their age, right? So just kind of making sure that that's clear, that the norm is to not use is really very important, and an important thing to kind of have as context when you're talking to a young person. Again, there's this, I can go on about this, but there's this important point where you really want to convey your expectations as a parent that they're young and they should not be using. Okay, now it sounds very simplistic and unrealistic to say, I expect you not to use. But you really do want to kind of have that be the endpoint of the message. Not like, hey, yeah, if you use, just do it sometimes. That's a different conversation. And that's more on like sort of the harm reduction side of things. If your child is already heavily engaged in using or uses regularly, and you need to kind of adjust how you're talking about it, that's a different thing. But when you're having these initial conversations, the stage you want to set is that young people their age should not be using marijuana. It's a drug, it's harmful to their health and safety, and that's what you're concerned about. At the same time, it's sort of a tightrope that you're walking, because you also want to convey that if they do end up using and they're in a risky situation or an unsafe situation, they should contact you and you'll be there to help them without major punishment and massive consequences coming down in that moment. So admittedly, it's a very hard conversation point to get across, where I expect you not to use. There will be consequences if you do use. But if you do use, please come to me, because I'm going to help you and make sure that you're safe and healthy and fine. So, but those are the things that have to be conveyed, even though they sound a little bit contradictory. And the best way to navigate that is to kind of have these conversations before the child starts using anything. Or hopefully they won't end up, but the consequences and the implications will be set early, so that they know what to expect. And those consequences should not be overly harsh. They shouldn't be overly punitive. They shouldn't be lasting too long. And they should be things that you're actually willing to follow through. And that if you have a partner, you're on the same page with your spouse or your partner about this, so that the kid isn't getting different messages. And you really want to encourage the healthier choices and reward your child for taking advantage of other means of having fun, alleviating stress, or staying away from situations or friends where they're using. That should be a positive instead of just the punishment negative perspective. And again, I can't emphasize enough how important it is to be a positive role model for young people. It's really hard to tell your kids to not do something if they're watching you, do it in a casual way. And that's not to say if you're an adult, again, in a legal state, and you want to use a drug, that's for you to do, but there's ways to do it where it's not in your kids' faces and made to seem like harmless and no big deal. And we also have managed to some extent to do this with other things where we say, this is for adults, it's not for young people. And here's why, give the reasons, it's different for kids, the effects are different. So I think that's really important to model healthy substance-related behaviors as an adult. And so if you come home from work and your kid sees you, oh God, I need to smoke, I need to take a pill, I'm so stressed, I have to have a drink. So then you're linking for them this notion of stress with a substance use, that's right there. Or, oh my God, I'm so excited to go out tonight, I can't wait to drink, to smoke, then you're linking for them that these substances are the way to have fun. So there's just ways to do it as an adult where it's not in the kid's face that these messages are coming across in the way you don't really intend them to. And if you are someone who uses drugs or actually any substance in the home, it's really important to keep them out of the sight and reach of young children or children of any age, actually. And there's plenty of ways we could talk about doing that. There's some great guides, including our own, which I will share with you later, about like really excellent conversation tips and real talking points about how to have these conversations. But again, it's so important to do it in a relaxed way. So in a comfortable setting and not overly formalized. Some tips we give sometimes is like, if you're in a car ride, taking your kid to a sports event or whatever, and they're next to you, you're not looking each other in the eye. They're kind of a captive audience, but the time is somewhat limited, so it won't drag on forever. Those are often good settings to kind of bring up these conversations. And you'd be like, oh, what do you think about these things? Or what are your friends doing? So not to kind of keep all the pressure on them. And what are you doing? Have you used drugs? It's more like asking about their friends and just sort of listening and opening it up for them to bring things up that are relevant. And, not to be judgmental and blamey, I think it's really important for parents to realize how pervasive the messages are about marijuana being like normal and fun and no big deal. So if your kids are thinking that it's really understandable that they're thinking that there's nothing wrong with them. They're not strange or bad kids, it's just, this is our society right now. And you kind of want to, again, I don't want to tell you how to parent, and everyone does it in different ways, but the more you're calm and attentive and come at it from a place of curiosity and understanding and speak to them in a way you'd want to be spoken to, it's just going to help the conversation come to a positive conclusion instead of just getting derailed. And if it is getting derailed, if there's like a bad reaction and it's not going the way you want, then just end it and you could pick it up another time. There's no need to kind of beat a dead horse and keep going at it. Again, this shouldn't be a one-time thing anyway. So if it's not going well, say, okay, this doesn't seem like the right time to talk about this. We'll pick it up another time. And then you find for another time to do so. But really what you want to do is get the message across that you should be delayed for as long as possible. And you can give them the reasons why. So I did mention we do have, again, these will be shared with you, a talk kit about specifically how to talk with teenagers and young people about marijuana. And it has really specific guidelines in there. Like if your kid says this, then you can say that. And if you say this and your kid responds this way, then this is what you do. So it's super helpful. It's one of our most popular products that we have, or, guides or tools, because it's really a helpful resource. So if your kid's saying nothing and just sitting there, we give you some ideas of what to do. So really help. And Stormy, I'm sorry, I think I moved ahead of where you wanted to.
No, that's all right. I was just going to emphasize what you had said about being side by side in a car or on a walk is ideal because it's less confrontational than saying, hey, I sit down, I want to talk to you. You learn a lot by listening there. And where you said about if it's not going well, it's okay. Change the subject. Just rather than having them shut down entirely, it's helpful if you hear them starting to, as we discuss in that parent's 20-minute guide, giving you red lights, or you want to stop before you hit a red light. You want to stop when their conversational signals are a yellow. They're giving you a caution.
Right. Yeah, that guide is, we put that out there. It's on our website as well, and it's a super helpful one, which we'll share with you as well. Now I just want to talk quickly before we move on to the other audiences about if you are concerned that they're actually using, what are some things you could do? So again, you want to talk with them, but you want to be looking for signs. So you might want to be alert to changes in appearance, mental health, behavior, social relationships. A lot of times people say, oh, is your kid acting irritably? And then the answer is, well, every teenager is irritable. So that's true. But here what we're talking about is consider the baseline of how obnoxious or difficult your child is. And has there been a significant change, right? Or is their appearance deteriorating? Are they less inclined to hang out with their friends socially? Or are they only hanging out with one or two specific friends? Are there signs of money problems? Because don't forget, these things cost a lot of money. So one tip we give people in the wealthier communities is don't give your kid, a credit card and an open, that they could just use money as much as they want. You kind of want to see where that money is going if you're concerned that your child might be using. Obviously, pay attention to the odor, if it's marijuana smoking, on their clothing or belongings, changes in eating patterns, because it does affect appetite, and obviously changes in grades and academic performance, because it affects that as well. Really important to consider that even kids who seem healthy and fine socially, as we said earlier, who are doing okay in school or doing okay in their sports, they might be using as well. And please try not to take this, not my kid's stance where, oh, my kid's a good kid, he or she wouldn't use. There are plenty of good kids who the parents didn't suspect were using or who are using, and they're still good kids anyway. It's not really related to that. It's just they happen to have taken a substance that's widely available and highly addictive, and it got to them. There's a lot of controversy around testing young people. Our stance is to not resort to testing. For the most part, it's better to sort of, from our perspective, be kind of awake and aware when your child gets home, give them a hug, look them in the eye, do the smell test, and just kind of supervise and monitor them and have a sense of it without resorting to testing. Testing kind of creates a certain dynamic. Now, a lot of people disagree about that, and you decide for your own family what works best. But for the most part, these sort of more trusting health safety approaches, as opposed to the kind of punitive "I caught you" approach, will generally work better. And again, there are exceptions. If they are using, we talked about trying to address the reasons why and find healthier ways of addressing those, but you really do want to reinforce your expectations and the consequences. And if it is starting to affect your child's health or relationships or academics, et cetera, you do want to seek help. And if you're not sure where to turn, there are many great resources. I would start with, your child's doctor or mental health provider or school. And there are these databases that have gotten really good, where it can really help you find resources in your own community that match what you need. And we also, on our own website and others, have support for the caregiver if they're trying to address a young person's substance use, as Stormy will attest to as well. And just keep in mind that if someone does develop a marijuana use disorder, there are treatments for it. It can be treated effectively, especially if it's addressed early when the symptoms first arise. So that's the reason to not kind of turn a blind eye to it and just hope it goes away. It doesn't go away. If you're concerned that your kid is using and it's affecting their life, then some sort of intervention will be needed. It's not to say they have to go away for months to a rehab necessarily, but some sort of intervention is needed, because these marijuana products they're using are quite highly addictive. Stormy, did I?
No, it was perfect, because I think it's very important. As parents, we often feel guilt when our children make unhealthy choices, and that can happen in any family. Substance use can happen in any family. It's not, as Linda said, the good kid, the bad kid. They're all good kids. Some are just making unhealthy choices. And some parents allow that feeling, that parent guilt, to lead to a stigma. They're concerned about what other people might think. And when you allow that stigma to interfere with getting help for your child, it can delay you seeking that treatment for your child, delay seeking the support that you need as a parent. You're not alone. If it happens in your family, you are not alone. It's a road that many parents have traveled, and there are support groups there for people to walk along with you as you journey through the path. And see it as a medical diagnosis. It is a medical diagnosis. And you wouldn't be ashamed if your child was diagnosed with diabetes. You would seek a good endocrinologist who can help guide them through healthy eating choices, whatever it takes. So please don't allow stigma and your parent guilt to get in the way. You've done nothing wrong. It's time to focus on your child.
That's right. And I want to leave time at the end for questions. So, again, this is the what not to do. There's a bit, of what we already talked about, but I'd really like just to emphasize, don't, just dismiss it as typical youth behavior or rite of passage. Again, keep in mind that most young people are not using, and if they are, it is something to be addressing. And, you can take a look at this later. We don't have much time to get into all the specifics about schools. But again, I will just like to, in addition to informing and educating young people, it's really important to involve parents in that education as well if you're a school, so that when a kid is in school and learning the stuff and then they go home, the messages could potentially be somewhat consistent. This kind of prevention messages can really be integrated into a lot of elements of the school curriculum and extracurricular programs as well. And we do know that kids who have things to do outside of school and during school that engage them and connect them with their school and community, civic engagement, those kids are more protected against any form of substance use as well. We want policies in schools, again, to be health and safety based instead of punitive and expulsion, suspension. Then the kids going home and smoking and using drugs and not doing it in school, but it's not really addressing the root cause of the problem, which is really so important. Schools could really play a significant role in their communities to try and help reduce access and exposure in the neighborhoods. So the kid leaves the school grounds. And then if there's 15 retail outlets right there selling them the stuff or advertising, that's a problem. So to the extent that schools are engaged in the community to reduce that exposure and access, it's really helpful. And again, be a part, along with parents, of addressing the risk factors to reduce, some of the causes and risk factors for substance use, including victimization and bullying and trauma and academic poor performance and stress, certainly stress, try and reduce those things that, we know increase the risk of substance use for young people, and to promote the protective factors that help. And again, you'll get these slides if you'd like to take a look at it later. We do think it's really important to engage families and communities in all these efforts and to offer counseling and treatment. If you can't do it on the school grounds or within the school itself, to have on hand resources that are affordable and accessible that a family could be referred to if they need help. And we also know that peer-to-peer support is really effective. So getting other kids involved to kind of spread these messages and help their peers and set a culture and climate in the school of non-use of substances is really super important. And obviously to kind of collect data relatively frequently so that you know what's going on in your school and what kind of programming is needed, and know how to address a problem if it arises with a young person. So then for health professionals, real quick, and then I'll end it. There's so much to say about what health professionals could be doing more and differently. I will give a quick anecdote of a young person I know who just went to a pediatrician at age 18 and was not asked one single thing about their marijuana use, or any substance use for that matter. And that's just like shocking. Not that kids will necessarily be honest, but you never know. And there might be that young person who wants someone to talk to, maybe doesn't feel comfortable doing so at home at school. And maybe this pediatrician they see once or twice a year seems like a good removed but knowledgeable person to talk with. So really important to ask these questions in a non-judgmental way and be a real source for young people of interventions and treatment if needed. And to really understand how marijuana use interacts with other co-occurring mental health disorders and physical problems, behavioral problems, sleep problems, respiratory issues. Just have it in mind that if you're seeing these kind of symptoms in a young person, that perhaps they are using substances. And also to really understand that most kids who use one substance use multiple substances. So if you know a kid is drinking, chances are you should be asking if they're also using marijuana. If you know they're vaping or using nicotine, really good thing to do is to check on the marijuana use as well, because those often go hand in hand. And that could be done through various forms of screening. There's a whole range of interventions that could be performed, and clearly to offer treatment to accessible and affordable resources if it's needed. I also really like to ask health professionals to be an advocate publicly for reducing marijuana exposure, access, and use among youth, because people listen to health professionals. And, there are cases of really highly respected pediatricians who are out there. They're on, news outlets doing interviews and talking about these issues. And they really have a lot of clout and can have a real impact on not just educating families and parents and people who are watching these kind of shows or listening to them, but policymakers as well. So I'm going to end there so we have time for questions. This is our website. That's my email address if anyone has specific questions. We have a brand new marijuana resource center that has tons of articles and information that's really up to date about all these things that tries to clarify the confusing landscape of marijuana right now. We have many personalized support services. Everything is free. And Stormy has really found that this Be a Part of the Conversation site is really a helpful resource for families and communities as well. So please try and seek that out.
Linda and
Yes.
Stormy, this has been an amazing. I think we could go on for about another hour. There's so much information, and we have lots and lots and lots of questions, and I can tell we're not going to be able to get to all of them. So here's what I'm going to say. Everybody, you will get your questions answered. We'll send them off to Stormy and Linda, and they can answer them individually. And then in 7 to 10 days, we will send you in your email the resources that were discussed today and the answers to the questions, and also posted on the NASDAQ website. There will be the video and the slides again. couple quick questions because we do have a couple of minutes. One big one was, and NASDAQ staff and partnership staff in general, you can jump in on this. What coalition should we get on board with to change laws? Are there organizations that are doing things to let the legislation know that this could be injurious?
I'll just say real quick that we're doing a lot of work, but it's more on the policymaker information level to kind of inform them of these things, but not direct advocacy so much. There is an organization called Smart Approaches to Marijuana that does direct advocacy and works with parents as well. And I could send that resource. And they do this kind of direct lobbying and advocacy to policymakers.
Well, if you can include it and send it in an email, that would be great.
Sure.
Stormy, there's a lot of questions for you. And one big one that was multiple was your son using marijuana with other prescription medications?
Yes. But it didn't start that way. The progression was nicotine, then marijuana. Then he started with, then that led to Xanax and benzodiazepines. There was occasional alcohol use in there as well, but quite frankly, that's harder to get for kids than illegal drugs. The drugs are available in any school, anywhere. And I'm sure all the educators on here recognize that that's true. I think one of the key important things for educators is to be honest about what's happening in your schools. I know a lot of people want it to be not our kids. Our kids are good kids. We don't have that problem. They're all good kids. The problem exists everywhere. And the more you hide it, the worse it gets. This way, parents are aware, families are aware, and you involve the parents in a solution.
Well, thank you. And one last one, and this will go to Linda. If a younger user delays their brain development with use at a young age, can they recover any losses, or is this a permanent damage?
So my understanding is that there is some recovery of brain function. And again, it's very much tied to the chronicity, the extent and how chronic the use was, and how intense the use was, and also what products were being used. So very high THC concentrated products cause more damage to the brain. More intense chronic use causes more damage. So it sort of depends on the extent. But yes, for most forms of substance use and addiction, actually, there is some brain recovery after someone stops using. So treatment is super important. And obviously the main message is as early as possible. Intervening as early as possible is really what's so important here to help the young person.
And thank you, Linda. Linda, Stormy, thank you so much for this. We have maybe 25 questions we didn't get to, so I will send them along.
Sure.
As everyone leaves today's webinar for the NASDAQ events, this is our last webinar for this season. We'll be back in September with school-based mental health. I hope you can join. In addition, as you're exiting, you will be taken to a survey. Please fill that survey out. We need that for our funders and to continue giving you and presenting here for webinars in the future. Also, after you fill out the survey, you will automatically be taken to get your certificate of attendance. So we appreciate all of you. Angela Bucket, I'm going to ask if you can stay on for an extra 5 minutes, because as the host leaves, this closes down and people have to leave on their own to get the survey. So once again, thank you. And I hope you have had an informative month for mental health acceptance. And the survey will be emailed as well with the resources that we discussed. Thank you, everyone.
Thank you.
Thank you, Stormy. Thank you,
so
Linda.
Thanks for having us.